Okay, I'm going to move on to a few more questions which I have from people on antibodies. And I know this is something which you have mentioned earlier, but perhaps maybe if I can probe you further, how long do these antibodies last? How long, at least, we have known for it to last? Post-COVID, post the first dose, post the second dose, how can we prolong it? I know you have answered this in bits and pieces, but if we can just put it in one block now about antibodies and how long it can last. In the three scenarios, in the three scenarios, post-COVID, post-first dose, post-second dose. Yeah. How to prolong it?
I'll take a stab at it first, and essentially my perspective of antibody testing is that the only thing it does is whet your curiosity on whether you've had an infection or not. We don't know well that antibodies by themselves, the presence of them, are not protective against a second infection. So having antibodies can be confusing. The only way I would interpret someone having antibodies is as a sign of, yes, you've had an infection, that's it. No other extrapolations from that. Doesn't prevent against a reinfection, doesn't offer immunity for about interpreting presence of antibodies with assuming that you are protected. And I just put in the chat box, just to finish that thought, a city in Brazil called Manaus, which had in their community 76% of their patients with antibodies, yet their second wave hit them really hard, overwhelmed their ICUs, got a lot of death. So having antibodies should not be measured that, yes, I can take my masks off, not take the vaccine or any other.
Can I just add a bit? I think what we need to definitely remember is that antibodies are not the be all and end all of our COVID and have not at all mounted an antibody response at all. So there are other ways by which the immune system works, and just measuring antibodies and being happy that I have a certain amount which is going to be able to fight, as Vikramjit says, is not the right thing to do. So vaccination definitely is the way forward to try and ensure that our immune system is competent enough to fight and not give us serious disease.
And a question from a very dear friend, is it actually possible, this is Rinda, is it actually possible that even after 2 doses, you may not have antibodies?
So yes, that is again a very difficult question to answer. I don't think everyone who's had vaccination at the moment has had their antibody levels checked, but then it is possible that you might not have mounted it, but that doesn't mean that you don't have immunity to it. There are memory cells, which are B cells and T cells, which will identify if you have been presented with an antigen to your system.
And of course, the severity point, which we mentioned earlier in the conversation, you also have to have that in mind. If you do get it, at least you won't have you may not have a casualty, and it may not get you to an ICU, which is very, very important.